Question 1. Your supervising BCBA asks you to track how many times a client hits their head within a 30-minute session. What type of data measurement should you use? A. Duration. B. Frequency. C. Latency. D. Partial interval recording. Answer: B. Frequency. This question is asking about different ways to measure behavior, specifically which method tells you how many times a behavior happens. The keyword "how many times" points directly to counting occurrences. Frequency recording is simply tallying each time the target behavior occurs. You would put a tally mark or click a counter every time the client hits their head. Duration is how long a behavior lasts. Latency is the time between a cue and the behavior, and interval recording measures if a behavior happens within a specific time block. Frequency is the simplest way to count occurrences. For example, if the client hits their head 5 times in 30 minutes, the frequency is 5. To remember this, think of frequency like how often something happens. It's just a count. Question 2. As an RBT, which of the following is not within your role and responsibilities? A. Implement behavior plans designed by the BCBA. B. Collect data on client behavior. C. Design and modify behavior intervention plans independently. D. Communicate with the BCBA about client progress and challenges. Answer: C. Design and modify behavior intervention plans independently. This question tests your understanding of the RBT's scope of practice. The keywords "not within your role" are important. You need to identify the task that RBTs are not qualified to do on their own. RBTs are paraprofessionals who work under the supervision of a BCBA. Board-certified behavior analyst. You are trained to implement plans and collect data and communicate with your supervisor, but designing or significantly changing complex behavior plans requires the advanced training and certification of a BCBA. It's crucial to know your boundaries. Think of it like this. The BCBA is the architect who designs the house, and you, the RBT, are the skilled builder who constructs it according to the plans. Your role is vital for implementing and observing, but not for the initial design or major redesign. Question 3. When a client is engaging in a challenging behavior, the first step in understanding why it's happening is often to determine the behaviors. A. Topography. B. Function. C. Intensity. D. Duration. Answer: B. Function. This question is about understanding the purpose behind a behavior, which is a core concept in ABA. The keyword "why" is a big clue here. In ABA, we don't just look at what a behavior looks like, topography, or how long or intense it is. We focus on what the client gets out of doing the behavior. This is called its function. Does the behavior help them get attention, escape something they don't want, get a tangible item, or is it automatically reinforcing? Feels good. Understanding the function is key because interventions are designed based on why the behavior is happening. For example, if a child screams to get attention, the function is attention. If they scream to get out of doing homework, the function is escape. Always ask, why are they doing this behavior, to find the function. Question 4. You are teaching a client to brush their teeth using a step-by-step process. You help them physically move their hand to brush their teeth. This type of assistance is called A. Verbal prompt. B. Gestural prompt. C. Full physical prompt. D. Model prompt. Answer: C. Full physical prompt. This question is asking about different types of help or prompts used to teach new skills. The phrase "help them physically move their hand" is the key descriptor. A full physical prompt is when you physically guide the learner's entire movement to complete the step or skill. A verbal prompt is telling them what to do, a gestural prompt is pointing or making a movement, and a model prompt is showing them how to do it. Physically guiding their hand is the most intrusive type of prompt, used when less help isn't enough. For example, if teaching a child to wave, you might gently take their hand and wave it for them. Think of full physical as giving full hands-on guidance. Question 5. What is the purpose of collecting ABC data? A. To count how many times a behavior occurs. B. To understand the context of a behavior, what happens before, during, and after. C. To measure how long a behavior lasts. D. To determine a client's favorite toys. Answer: B. To understand the context of a behavior, what happens before, during, and after. This question focuses on a specific data collection method called ABC data. The acronym ABC stands for antecedent, behavior, and consequence, which are the keywords here. The antecedent is what happens right before the behavior. The behavior is what the client does. The consequence is what happens right after the behavior. Collecting this data helps us see patterns and understand why the behavior might be happening. Its function: by looking at the situation around it. It's like being a detective trying to understand a behavior by examining the scene before, during, and after. It's not about just counting frequency, or timing, duration, or finding preferences. ABC data gives us the story of the behavior. Question 6. Your BCBA asks you to measure the time from when a client is given an instruction, clean up your toys, until they start cleaning. What dimension of behavior are you measuring? A. Frequency. B. Duration. C. Latency. D. Interresponse time, IRT. Answer: C. Latency. This question is about measuring the time it takes for a behavior to start after a specific cue or instruction. The phrase "time from when" until they start is the defining characteristic. Latency is the time between a stimulus, like an instruction, and the onset of a response, like starting to clean. Frequency is the count. Duration is how long the behavior lasts once it starts, and IRT is the time between two occurrences of the same behavior. Measuring latency helps us understand how quickly a client responds to instructions. For example, if you say, "touch your nose," and it takes them 5 seconds to do it, the latency is 5 seconds. Remember, latency is the lag time before the behavior begins. Question 7. In discrete trial training, DTT, what happens immediately after the client gives the correct response? A. A new instruction is given. B. The trial ends and reinforcement is delivered. C. The prompt is faded. D. Data is collected and the next trial starts. Answer: B. The trial ends and reinforcement is delivered. This question is specifically about the flow of a discrete trial training, DTT, session, which is a structured teaching method. In DTT, a trial is a single teaching opportunity. The sequence is usually: the therapist gives a clear instruction. STE, the client responds. The therapist delivers a consequence, like reinforcement for a correct answer or a correction for an incorrect one. And then there's a pause before the next trial. The most immediate consequence for a correct response is usually reinforcement to make that behavior more likely to happen again. While data is collected during or after the trial, and prompts might be faded over time, the immediate step after a correct response is getting the reward. Think of it as instruction greater than response, greater than reward for being right. Question 8. A client often throws toys when they want attention. Your BCBA tells you to use extinction, which means that when the client throws a toy, you should: A. Give them immediate attention to calm them down. B. Ignore the behavior completely. C. Take the toy away and give them a timeout. D. Redirect them to play appropriately. Answer: B. Ignore the behavior completely. This question describes a scenario and asks what to do if you're using the extinction procedure. The key is understanding what extinction means in ABA. Extinction is when you stop providing the reinforcement that was maintaining a behavior. In this case, the behavior, throwing toys, was happening because it resulted in attention. To put this behavior on extinction for attention, you would stop giving the client attention when they throw toys. This means ignoring the behavior, giving attention, A. Timeout. C. Or even redirection. D. Might still provide some form of attention or change in environment that could reinforce the behavior. True extinction means withholding the specific consequence that was previously making the behavior happen. It's about breaking the link between the behavior and the reward it usually gets. Question 9. Teaching a client to wash their hands by breaking it down into small steps. Turn on water, wet hands, get soap, etc. And teaching each step in order is an example of A. Shaping. B. Discrimination training. C. Chaining. D. Naturalistic teaching. Answer C. Chaining. This question describes a method for teaching complex skills that involve a sequence of steps. The phrase breaking it down into small steps and teaching each step in order is the hallmark of chaining. Chaining is used to teach skills made up of several smaller actions linked together, like washing hands, getting dressed, or making a sandwich. Each step acts as a cue for the next step. Shaping involves gradually changing a behavior. Discrimination training teaches the difference between things, and naturalistic teaching happens in the client's everyday environment. When you see a skill broken down into a list of steps that need to be done in order, think chain. Question 10. How often should an RBT typically receive supervision from a BCBA or BCABA? A. Only when a problem arises. B. A minimum of 5% of the hours spent providing behavior analytics services per month. C. Once a year for performance review. D. Daily for every single session. Answer B. A minimum of 5% of the hours spent providing behavior analytics services per month. This question is about the professional requirements for RBTs regarding supervision. The keyword here is typically receive supervision, and is asking about the required minimum frequency. The Behavior Analyst Certification Board, BACB, sets ethical and training standards, and they require RBTs to receive supervision for at least 5% of the behavior analytic hours they work each month. This supervision must be provided by a qualified BCBA or BCABA, and includes both face-to-face time and potentially other formats. It's not just when there's a problem, not just once a year, and usually not daily for every session. This ensures RBTs are properly supported and guided in their work. Think of the 5% rule as a standard check-in to make sure everything is on track and you're getting the support you need. Question 11. You are asked to measure if a client is engaging in on-task behavior during a 30-minute group activity by checking only at the very end of every 5-minute interval. If the client is on task at that specific moment, you record a plus. If not, you record a. What type of measurement is this? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Frequency. Answer C. Momentary time sampling. This question describes a specific type of interval recording. The key phrase is checking only at the very end of every 5-minute interval. Momentary time sampling is a method where you record whether the behavior is occurring only at the exact moment the interval ends. Whole interval recording measures if the behavior occurred throughout the entire interval, and partial interval recording measures if the behavior occurred at any point during the interval. Frequency is just counting occurrences. Momentary time sampling is useful for behaviors that happen continuously or are hard to track constantly. Imagine you have a timer, and only when it beeps do you glance up and see if the client is on task right then. If they are, you mark it. Question 12. A client rarely speaks. You start by giving them a preferred item, like a cracker, whenever they make any sound. Once they are making sounds more often, you only give them a cracker when the sound is closer to a word, then only for approximations of cracker, and finally, only for the word cracker. This process is an example of A. Chaining. B. Shaping. C. Prompting. D. Extinction. Answer B. Shaping. This question describes how to teach a new behavior by rewarding gradual steps towards the final desired behavior. The core idea is rewarding successive approximations, or behaviors that get closer and closer to the target. This method is called shaping. You start by reinforcing a behavior the client can already do, making any sound. Then you raise the requirement for reinforcement little by little until they are doing the full target behavior, saying cracker. Chaining teaches a sequence of steps. Prompting gives help, and extinction stops reinforcement. Shaping is like sculpting behavior. You start with something rough and gradually mold it into the desired form by reinforcing improvements. Question 13. A client frequently asks for snacks throughout the day. Your BCBA suggests a plan where you only provide snacks at specific, scheduled times and provide lots of praise and attention when the client engages in other appropriate activities instead of asking for snacks between those times. This is an example of A. Extinction, B. Punishment, C. Differential reinforcement, D. Response blocking. Answer: C. Differential reinforcement. This question describes a common behavior reduction strategy. The plan involves reinforcing alternative or appropriate behaviors, playing appropriately, waiting, while withholding reinforcement for the challenging behavior, asking for snacks at unscheduled times. This strategy is called differential reinforcement. You are reinforcing differential, the desired behavior, while not reinforcing the challenging one. Extinction means withholding reinforcement for the target behavior altogether. Punishment involves adding or removing something to decrease the behavior, and response blocking physically prevents the behavior. Differential reinforcement is a positive and effective way to reduce unwanted behavior by teaching and reinforcing what you do want the client to do instead. Question 14. You are teaching a client to point to a picture of a cat when you say, "Touch cat." Initially, you use a full physical prompt, guiding their finger. As they start to respond faster, you switch to just tapping the picture, then pointing, then just gesturing towards the picture, and finally giving no prompt at all. This gradual removal of prompts is called A. Shaping, B. Prompt fading, C. Chaining, D. Stimulus control. Answer: B. Prompt fading. This question describes the process of reducing the amount of help you give a client as they learn a skill. The phrase gradual removal of prompts is the key. Prompt fading is systematically reducing the intensity or type of prompt you use to help the client respond correctly, with the goal of the client eventually performing the skill independently without any help. Shaping is about gradually changing the behavior itself, chaining is teaching a sequence of steps, and stimulus control is when a behavior happens only when a specific cue is present. Fading prompts is like removing the training wheels from a bicycle little by little as the rider gets better. Question 15. Before starting a teaching session, you let the client choose between playing with blocks, reading a book, or coloring. This is an informal way to identify potential motivators or rewards for the session. What type of assessment are you conducting? A. Skills assessment, B. Preference assessment, C. Functional assessment, D. Behavior assessment. Answer: B. Preference assessment. This question asks about how we figure out what a client likes, which is essential for finding good motivators. The action described, letting the client choose between items to see what they like, is a basic way to do a preference assessment. A preference assessment is any method used to determine what items, activities, or events might function as reinforcement for a client. A skills assessment checks what the client can do, a functional assessment tries to figure out why a behavior happens, and a general behavior assessment covers various aspects of behavior. Finding out what a client enjoys helps us pick rewards that will make learning more effective and fun. Think of it as taking a lickability survey for the client. Question 16. You are working with a client and discover sensitive information about their family that is not relevant to your behavior services. What should you do with this information? A. Share it with your own family or friends, but don't use the client's name. B. Discuss it with the client's other therapists or teachers to build a comprehensive picture. C. Keep the information confidential and do not share it unless required by law or your supervisor for clinical purposes. D. Record it in the client's notes just in case it becomes relevant later. Answer: C. Keep the information confidential and do not share it unless required by law or your supervisor for clinical purposes. This question addresses a crucial ethical responsibility of RBTs: confidentiality. The keyword is confidential information and not relevant to your services. You are obligated to protect the privacy of your clients and their families. Information learned during your work should only be shared on a need-to-know basis for the client's clinical care with your supervisor or as legally required. Sharing it with friends or family, A, or even with other professionals unless it's directly related to coordinating care approved by your supervisor and the family, B, or recording irrelevant details, D, violates confidentiality. Your client's privacy is paramount, so only share information when absolutely necessary and authorized. Question 17. Your BCBA asks you to take data on a client's hand flapping behavior using momentary time sampling. If you set a timer for every 1 minute, when should you check if the hand flapping is occurring? A. Throughout the entire 1 minute interval. B. At any point during the 1 minute interval. C. Exactly at the moment the 1 minute timer goes off. D. For 10 seconds after the timer goes off. Answer: C. Exactly at the moment the 1 minute timer goes off. This question retests your understanding of momentary time sampling, specifically when you check for the behavior. As covered earlier, the definition of momentary time sampling is checking for the behavior only at the precise moment the interval ends. Option A describes whole interval recording, and option B describes partial interval recording. You are not checking the whole time or any time during the interval, only the exact moment the timer beeps. This makes it easier to collect data for behaviors that happen frequently or continuously, as you don't have to watch constantly. Just remember, with momentary time sampling, you only look at that moment. Question 18. You are teaching a client to point to the picture of an apple when you say, touch apple, and to point to the picture of a banana when you say, touch banana. This type of teaching is called A. Chaining, B. Shaping, C. Discrimination training, D. Generalization. Answer: C. Discrimination training. This question describes teaching a client to respond differently to different cues or stimuli. The goal is for the client to discriminate or tell the difference between the instruction touch apple and touch banana, and respond correctly to each. This is the definition of discrimination training. Chaining teaches the sequence of steps, shaping teaches a new behavior gradually, and generalization is when a skill learned in one situation occurs in other situations. When you teach a client to pick the correct item or perform the correct action based on a specific instruction or object, you are teaching them to discriminate. Think of it as teaching them to pick the right item out of a lineup based on your command. Question 19. If a client is engaging in severe problem behavior that poses an immediate risk of harm to themselves or others, your first step should be to A. Immediately implement the behavior plan steps. B. Collect ABC data on the behavior. C. Ensure safety and implement your agency's crisis plan or safety procedures. D. Physically restrain the client until the behavior stops. Answer: C. Ensure safety and implement your agency's crisis plan or safety procedures. This question is about what to do in a crisis or emergency situation involving severe behavior. The key phrase is immediate risk of harm. While implementing the behavior plan and collecting data are usually important, safety is always the absolute top priority in an emergency. You should follow your agency's specific pre-established crisis or safety plan, which outlines procedures for ensuring everyone's safety during dangerous behaviors: physical restraint, D should only be used as a last resort and only if explicitly outlined in a crisis plan and you are trained to do so and not as a first step. Always prioritize safety first. Question 20. An RBT is working with a client and their family. The family wants to invite the RBT to their child's birthday party on a Saturday. Accepting this invitation would be an example of a potential issue with A. Confidentiality, B. Professional boundaries, C. Data collection, D. Supervision requirements. Answer: B. Professional boundaries. This question is about maintaining appropriate relationships with clients and their families. Accepting social invitations from a client's family falls outside of the professional relationship and can blur the lines between being a therapist/technician and being a friend. Maintaining clear professional boundaries is essential for ethical practice. Confidentiality: A. Relates to privacy, data collection. C. Is about measurement and supervision requirements. D. Relate to meeting with your supervisor. While it might seem friendly, accepting personal invitations like this can compromise your objectivity and professional role. It's usually best practice to politely decline social invitations to maintain professional distance. Question 21. Which of the following is a type of continuous measurement? A. Partial interval recording. B. Momentary time sampling. C. Frequency. D. Whole interval recording. Answer: C. Frequency. This question asks you to identify a type of continuous measurement. Continuous measurement means you are recording every single instance of the behavior during the observation period. Frequency, counting every time, and duration, timing how long it lasts every time, are examples of continuous measurement. Interval recording methods like partial, whole, and momentary time sampling are considered discontinuous measurement because you are only observing or recording during specific intervals or moments, not continuously tracking every instance. If you need to count every occurrence, you are using continuous measurement like frequency. Question 22. You are working with a client in their home, and they spontaneously pick up a toy car. You immediately label the toy car, car, and prompt the client to imitate you, reinforcing their attempt. This style of teaching, using the client's interests in the natural environment, is most characteristic of A. Discrete trial training, DTT. B. Mass trials. C. Naturalistic teaching strategies. D. Task analysis. Answer: C. Naturalistic teaching strategies. This question describes teaching that happens within the client's everyday environment and uses their current interests as teaching opportunities. The key phrases are spontaneously pick up a toy, in their home, and using the client's interests. Naturalistic teaching strategies, often called NET or natural environment teaching, involve teaching skills within the daily routines and activities the client is already engaging in, using the things they are naturally motivated by. DTT. A. Is more structured and often done at a table. Mass trials. B. Involve presenting the same instruction repeatedly and task analysis. D. Is breaking down a skill into steps related to chaining. Naturalistic teaching blends teaching into play and daily life. Think of it as capturing teaching moments as they naturally occur. Question 23. A client repeatedly taps their foot when they are waiting in line at the store. This behavior doesn't seem to get them attention, escape anything, or get them access to items. It appears they do it because it feels good or is stimulating to them. This suggests the function of the behavior might be A. Attention. B. Escape. C. Tangible. D. Automatic. Sensory. Answer: D. Automatic. Sensory. This question asks you to identify the likely function of a behavior based on the description provided. The description explicitly rules out getting attention. A. Escaping something. B. Or getting an item. C. When a behavior happens because the sensation or feeling of doing it is reinforcing on its own, without needing anything from the environment or another person, It's considered to have an automatic function. This is sometimes also called sensory reinforcement. Tapping a foot, hand flapping, or repeating sounds might fall into this category if they are internally reinforcing. If it doesn't seem to be for attention, escape, or getting something, consider if it's automatically reinforcing because of how it feels. Question 24. When communicating with your BCBA supervisor, which of the following is most important? A. Using complex ABA jargon to sound knowledgeable. B. Only contacting them when there's a major problem. C. Providing clear, objective information about client progress and any concerns. D. Waiting for them to contact you first. Answer: C. Providing clear, objective information about client progress and any concerns. This question is about effective communication with your supervisor. Your BCBA relies on you to be their eyes and ears on the ground. It's crucial to communicate regularly and provide factual information about what's happening in sessions, how the client is progressing with goals, what behaviors you're seeing, and any issues that come up. Using overly complex jargon, A, isn't necessary, waiting for problems, B, or waiting for them to contact you. D, can delay necessary support or plan adjustments. Clear, timely, and objective communication helps your supervisor make informed decisions and support you and the client effectively. Think of your communication as providing essential updates and requesting guidance when needed. Question 25. You have been collecting frequency data on a client's hitting behavior for a week. The BCBA asks you to show them the data on a graph. What type of graph is most commonly used in ABA to display frequency data over time? A. Bar graph. B. Scatter plot. C. Line graph. D. Pie chart. Answer: C. Line graph. This question asks about the standard way to visually represent frequency data, or most other types of quantitative data like duration or percentage, over sessions or days in ABA. Line graphs are the most common way to plot behavior data over time in ABA because they clearly show trends, whether the behavior is increasing, decreasing, or staying the same across sessions. Bar graphs are good for comparing different items or conditions. Scatter plots show relationships between two sets of data, and pie charts show parts of a whole. For tracking a behavior's frequency or other measure across different observation points, like sessions or days, a line graph is your go-to in ABA to see the trend. Think of it like tracking progress on a timeline. A line graph shows the journey.